Okay, everybody, good morning. I'll get started because I don't want to delay your morning, so everybody can join as we start. So good morning to everybody, and thank you for joining us this morning for our workplace webinar for why every business should have a drug and alcohol policy. I'm Verity, the marketing manager for workplace here at AlphaBiolabs. Before I pass you over to Barbara, our workplace company trainer, who will be presenting the webinar for you today, I just want to quickly run through the agenda and a few housekeeping points. So for the agenda today, we'll be looking at the impact of drug and alcohol misuse in the workplace, the reasons why a business needs a policy and the risks of not having one, what a policy should contain, how to implement it, and how that can affect your employees. And lastly, the importance of awareness training within the workplace. Following that, we will have a Q&A session. So please pop your Q&A questions into the Q&A function, and then we can go through those at the end. If we don't have time to go through all of your questions, they will be sent out via a link for you to view after the webinar, which will be with you tomorrow. I'll also be hosting some polls during the webinar, so if you could take time just to answer those questions as well, that would be fantastic. And then after the webinar, there will be a short survey. It's 4 questions, so it should only take a minute or so to fill in, if you wouldn't mind completing that. If you do have any technical issues during the webinar, please use the chat function and we'll try and sort those out for you as we go along, but hopefully everything will run smoothly. So before I hand over to Barbara, I'm just going to launch our first poll of the morning. Our first poll is, would you be able to recognise the signs of substance misuse in the workplace? Simple answers of yes, no, or don't know. I'll just launch that now for you. And I'll just give you a couple of minutes to answer that, and then I'll pass you over to Barbara. Thank you. Some interesting results coming through there, Barbara. I'm going to share those with everybody now so everybody can see the results. You should down, I'll be able to see those, the results. So we've got 63% saying yes, they've got they would be able to recognise the symptoms, 14% saying no, and 23% saying don't know. So quite a mix there, Barbara. So I'm going to hand you over to Barbara now, who will be presenting the webinar for you today. I hope you find today enjoyable and informative, and I will see you later on in the webinar. Thank you.
Good morning, everyone, and thank you for joining today. Obviously, we've got a lot to get through, so I'm going to start straight away, if that's okay with everybody. As Verity has mentioned, please use the Q&A function within this webinar, and we will address any questions either at the end of this session or in the email that Verity mentioned. So let's face it, we've had a very hard couple of years with COVID, and we've also now got the looming situation of the economic costs and cost of living rises. Quite often during these times, people will turn to alcohol and drugs as a coping mechanism, especially as it's readily available out there. In particular, alcohol is readily available out there. It's available 365 days a year, 7 days a week, virtually every hour of the day. And drug and alcohol misuse are significant issues in UK society, and your workplaces are made up of those societies. CIPD in 2020 found that 27% of people that were employed had increased their alcohol consumption within the pandemic. And Public Health England also published a paper saying that alcohol consumption had increased in so much as, in the year 20 to 21, an additional 12.6 million litres of alcohol were sold, and that is just in supermarkets and shops. Obviously, that doesn't account for the business premises that reopened in terms of pubs, etc. The use of alcohol and drugs has increased, but by far and away, alcohol is sort of like top of the leaderboard when it comes to things like ill health and disability. The majority of 15 to 49-year-olds, have misused alcohol consistently within the last couple of years. So let's have a look at a few more of the facts. So more than 9 million people in the UK drink more than the recommended daily limits, and as many of 20% of adults may be drinking more after the 3 lockdowns. Well, we've seen that with the increase that I've just mentioned in terms of Public Health England, about the 12.6 extra litres of alcohol. So what about drugs? Well, 1 in 11 adults aged 16 to 59 have taken a drug in the last year, which equates to 3.2 million people within the UK. And an estimated 1.5 million people are addicted to prescription and over-the-counter drugs. Just to put that into context, Public Health England have published some stats surrounding prescription medicines, and currently there stands about 11.5 million people in England alone. That's 26% of society are on prescription medication. Some of that medication includes things like antidepressants. That's 7.3 million people are taking an antidepressant. And opiate type medicine, which is traditionally your pain medication. That could be things like codeine and tramadol. That's 5.6 million people. Now, whilst prescription medicines are different from illicit substances, it doesn't mean to say that they're any less addictive. And in some cases, they can actually be easier to obtain. And more often than not, you will see opiates within your workplace setting. People can obtain these from not only GPs, but they can go to pharmacists for opiate type medicines. They can approach their family and friends. They can actually go to street dealers. There's an increase about street dealing in medication out there at the moment. There's been lots of police operations on where people have found supplies of prescription type medicines that are filtrating through onto the streets. All these medications have their own side effects. They can come with warnings saying don't drive and operate machinery. So you can see if people are using opiate type medicines in the workplace, that could actually have an impact on your workplace setting as well. And we've all seen it in workplaces. You know, somebody has a headache, another colleague comes along and goes, oh, I've got such the thing for you. I've got these amazing tablets called tramadol. They'll get rid of that headache for you. Well, there are a couple of risks associated with that. One, the person who's giving that tablet away actually commits offences under the Medicines Act, which they may not be aware of. But secondly, they don't really know that history of that person they're giving the drug to. So that could have some severe consequences for that person in terms of allergies as well. So there are some associated risks. So what about the industries? There's a common misconception that drug addicts and people that abuse alcohol are outcasts. They're antisocial people. They conduct criminal activity to support their addiction. And where to a certain degree that is true, it's not the case in every single instance. Drug and alcohol is a significant social problem that cuts across every area of society. So it's not surprising it touches on all the workplace communities. And you can see on there, on this slide, there's some of the industries where drug and alcohol is an issue within the workplace. On the left-hand side, they've got the industries with most problems, and that's based on 1,000 workers, per 1,000 workers. And you can see construction and mining there, wholesale, retail, leisure, hospitality. Those people have ready access to alcohol in a lot of instances and drugs. Your maintenance and repair. Industries with the highest rate of drug use, again, on the right-hand side, things like food preparation and serving, construction, arts and design, and so on and so forth. So let's put a little bit of context behind that as well. So I'm going to give you some examples of some press articles that have been out fairly recently, just to show how far spread drug and alcohol misuse is. So these are genuine articles that have appeared in the press. On the left-hand side there, you can see that a pilot was arrested on suspicion of being over the legal alcohol limit for pilots. Just about to take off, here's American Airlines flight to Philadelphia. We have the head of the Co-op Bank, who had £1.3 billion worth of assets at his disposal. He was arrested and charged with possession of cocaine, crystal methamphetamine. We've got the train driver who's gone through the buffers at a London Borough station because he's been under the influence of cocaine. We've got the school minibus driver, very scarily, small children on a school bus, again, under the influence of drugs. And we've got in the middle there, we've got the police officer. This is a chap called Nicholas Conn. Basically started taking drugs, cocaine, when he joined the police. And built up about a £300 to £400 a day habit with cocaine. And this is all at the time when he's actually policing other people, taking drugs and arresting people for drug offences, and all the time taking the drugs himself. That situation got so out of hand, he actually ended up being a drug runner for an Albanian drugs cartel that was operating within the UK. So you can just see from those snapshots of headlines there that it does absolutely affect everybody. So it's not necessarily the man in the boiler suit. It can be your head of departments or your CEO of businesses. So what does this mean for yourselves? What does it mean for UK businesses? Well, businesses can be a contributing factor for somebody using alcohol. You know, everybody's under pressure. We work long working hours. We have to do a lot more within our working day. There might be physical demands there. It might be that poor pay and lack of motivation creeps in and people turn to alcohol and drugs just to get through the day. It can be that people are unsupervised in a workplace setting as well. So there's lots of reasons why that can happen. So in UK businesses, up to 17 million working days are lost each year because of alcohol-related sickness. And cost to employees of sick days is estimated at £1.7 billion. Now, quite honestly, people aren't going to ring in work and say that they're sick with alcohol or drug-related symptoms. It's more likely they're going to say that they've had, a dodgy curry the night before and they've got an upset stomach. So, this is based on people's honesty and the stats that can be gathered. There's obviously, that could really probably increase, if I'm honest. Quite scarily, a third of employees admitted having been to work with a hangover. 15% have reported actually being drunk at work, and 25% have said that drugs and alcohol have affected them at work in some way. So let's have a look at some of the stats concerning drugs. 70% of individuals who abuse drugs are employed full-time. So again, it goes against that myth of people being what I'd like to say, that the unemployed great unwashed of society. It's not. These are people that are actually employed full-time within businesses. That equates to 17% of the workforce in the UK, and 3 million of those employees attend work under the influence of some kind of substance. Quite interestingly as well, in August of 2020, the CIPD produced a review and stated that in the last 2 years, 25% of employees had been disciplined for alcohol and just over 25% for drugs. And of those, 20% were dismissed because of some form of substance abuse. And again, those stats are coming from people within the workplace setting that actually have a policy in place. So no doubt those figures will be highly inflated for the people that don't have policies in place. And as we all know, if an employee arrives at work with raised alcohol or levels or is under the influence of drugs, then the likelihood of having an accident or an injury or hurting somebody else increases. So what are the effects of substance misuse? Well, there's lots of effects. Big one, yes, it can mean an increased rate of injuries and accident rates in the workplace. Some of these on this slide are interlinked, so I'm going to talk about them in a sort of a general way. But obviously the policy could prevent accident and injuries in the workplace. Increased absenteeism, we already mentioned about the lost number of days due to alcohol and substance misuse. As I said, those figures may be more inflated because, not everybody's going to be honest as to the reason why they're actually off work. They're not going to ring in and say, I've got a hangover, I can't come in, or I've just taken drugs the night before. They'll come up with another reason to ring in sick. But loss of production right across the business can happen because somebody's absent. That puts people under increased pressure as well. Your other co-workers may be at risk, especially if they're picking up the slack for other workers as well. That could make them turn to drugs or alcohol as a coping strategy. Lack of concentration and focus, that can be quite all across the board, really, lack of concentration and focus. It's not just about your machine operators here or people that drive forklift trucks. It could be that concentration focus means people that work in back office roles have got less attention to what they're actually doing. Theft from the company or in colleagues. Quite often, you will find levels of theft creeping in within your business. Obviously, drugs and alcohol come at a cost. They have to be purchased. And if somebody's sort of got a regular habit, that cost is going to go up and up and up. So it can be low-level thefts from things like people's lockers, or it could be a piece of company equipment that goes missing. Concentration and focus we talked about before, that can lead to your poor decision making. And I think it's very important to say at this stage as well, poor decision making, sometimes people that get left out of policies are people that sit in the back office. You know, let's say, for instance, your health and safety manager. It could be that they're signing off a safety critical piece of documentation that's going to affect the workforce. But if they're not concentrating and they're not focusing on the task in hand due to alcohol or drug misuse, then they could potentially sign off a decision that is not safe for the employees in the business. So therefore, there would be that increased safety risk to themselves and others. We all know the effects of alcohol, and probably due to the press and TV programs, we all know the effects of drugs. So you can see an increase in erratic workplace behaviours, which can lead to violence, sexual harassment, aggressive, abusive language, and it can have an overall effect on impacting the team morale. People tend to be a bit braver when they've had a drink. And they tend to certainly be a little bit more braver when they've had drugs as well, especially if they're taking sort of a stimulant. Workplace behaviours can change. Say, for instance, you might have confrontation with co-workers. It could be that a team leader has challenged somebody because of their lack of productivity. But because somebody's under the influence, there could be that conflict there that could arise. So some other impacts, increase insurance claims and rise in insurance policy costs. I've done some research recently and I found that the majority of insurance claims are to do with accidents and injuries in workplaces, rather than outside in a normal sort of outside setting, if you would like. Employees are more likely to bring a claim against people's insurance policies. Increasingly as well, insurance policies are asking companies whether or not they have a drug and alcohol policy in place to try and reduce some of the risks associated with that. Some companies will even go as far as, if somebody has had a conviction for drug or drink driving outside of the workplace in their own private time, but say, for instance, they come into a business and perhaps drive a forklift truck, when the company has tried to insure them, the insurance companies are refusing them on the basis there is an increased risk because of their previous private life history surrounding drugs and alcohol. Some of the other risks associated are risks of breaching both your criminal and civil law, and I'm going to talk about those later on in the presentation. Increase in disciplinary procedures, yes, if you've got a drug and alcohol policy, or even if you haven't got one and people are found to have drug or alcohol in either with them or they've used it at work, you're going to use disciplinary procedures, which all takes time. It diverts your HR from the other things they're supposed to be doing in the business because their focus now becomes on those individuals. If you are going to dismiss people because they're going constantly absent because of drug and alcohol related illnesses, or even if they're just constantly ringing in sick, you're going to have a higher turnover of staff because the chances are you're going to end up dismissing that person. Or it might be that their behaviours have warranted a dismissal. So think about your confrontation situations I just spoke about. It could be that's gross misconduct and you get rid of them. So all of that comes at a cost to yourselves, a higher turnover of staff. You've got recruitment issues. You've then got to train staff. And also as well, people do suddenly start turning to drug and alcohol as a coping strategy. So it might be that you actually dismiss somebody that has got a long-term standing with that business. So you're losing that expertise. So there's lots of reasons why it can impact yourselves as a workplace. So I'm now going to hand over to Verity for the second poll.
Thanks, Barbara. I'm just about to launch the second poll, which is asking, do you currently have a drug and alcohol policy in place within your workplace at the moment? Again, it's simple answers of yes, no, or don't know. I'll launch that now and then give you a couple of minutes to answer that question. Thank you. Thank you very much. I'll share the results again, some interesting results there, Barbara. We've got a 71% yes, 24% no, and 5% that don't know.
Very interesting. Thank you, Verity. I'm not sure actually which one I would say would be the worst of the two, not knowing or not having one. So next slide, the reasons why a business needs a policy and the risks of not having one. I would quite simply ask, why would you not have one in place, given that you've got a duty of care to your employees and members of the public? Because having a policy reduces any of potential risks. It's no use waiting until you've got an incident or an accident before you actually putting one in place. Especially as you'd have no guidelines to work to. How do you deal with it? What are you going to do with this person? There's no framework there for you to deal with any incidents if you don't have a policy in the workplace. So interestingly enough, in March of this year, we asked 500 senior managers about their substance misuse policy. 20% admitted that their businesses did not have one, 10% didn't know if they had one, and 1 in 5 senior managers actually stated that they were not confident in spotting the signs of substance misuse. To me, you know, working in this industry, that is a clear sign that there is a need for policies and there is a need for awareness training, both for employees and senior management. So we've talked a lot about policies. So what should they contain? Well, the reason behind it, first and foremost, is that successfully tackling drug misuse can benefit both your business and your employees. It provides a more open environment for discussing drug and alcohol issues. And a drug and alcohol-free workplace will show that you're actually taking an active interest in their health and safety and their working environments. So not only are you protecting them and their colleagues, you're also trying to protect the policy. Really, the overall aim of the policy shouldn't be one of intrusion. It shouldn't be one of, you know, punishment straight from the get-go. And it shouldn't be really one that interferes in people's private lives. But that said, people should have an understanding that what they do outside, if they bring it into the workplace, can have impacts. But it's also about job security. You know, if you get a reputation as a business that your employees turn, you know, I see them in the pub every day, they go into the pub before they go to work, you know, they're drinking alcohol before they go, you know, there's been accident, there's been injuries that hit the press. Obviously, it's going to put a real big dent into your company brand and reputation. And also with tenders as well, increasingly people are asking when people are putting work out for tender, have you got a drug and alcohol policy? So what is it? Well, it'll define your company's stance in relation to drug and alcohol. It will set clear, defined standards for absolutely everybody, no matter what their role is in within the business. It will give clear and concise instructions for the employer and employee, and that encompasses in all sorts of things like what is the employee responsibilities in the workplace, as well as your legal obligations as well. It will also detail what non-compliance means to that person and how substance issues will be handled. And I'm going to touch on those two later on in the presentation as well. But also in that policy as well, there should be something in place that says, these are the set procedures for you seeking help. If you've got an issue, these are the people that you can go to and seek support. So some of the risks of not having a policy, well, there are risks to the employees themselves, but more importantly as well, as you as employees actually could be breaking the law if you knowingly allow drug and alcohol activities to take place in your workplace. So it's very important that people know that. So some of the legislation, you probably are aware of it, so I'm going to scoop through some of these. We talked about this early on, Health and Safety at Work Act. You have a general duty under that act to ensure, as reasonably practicable, the health and safety and welfare, very important word there, welfare, of your work employees. The next one there is you've got the Management of Health and Safety Work Regulations, excuse me. As you as an employee, if you knowingly allow somebody to work under the influence of drugs or alcohol and their behaviour either places themselves or others at risk, you as an employee could be prosecuted. And obviously the employees themselves have that duty under that Management of Health and Safety at Work regulations. You have the Road Traffic Act, absolutely applicable to everybody on the road, whether it's a social or professional driver, not to be either in charge or attempting to drive or driving a motor vehicle under the influence of drugs or alcohol. 2015, new legislation came in, drug driving legislation. There are now 16 substances on that list where you can be tested as a driver. At one end, you've got things like cannabis and cocaine, and then you've got a whole list of prescription type medication. You can also commit an offence where you cause, aid or abet such an offence. And I always call these the encouragement offences. For example, you're a manager and you have a delivery that needs to reach a client at a certain time and you're under pressure to get that delivered. You've got a suspicion that your driver is actually under the influence of alcohol. But despite that, you send them out. If that person then goes and commits an offence outside whilst they're driving that vehicle, and it's found that they are perhaps over the limit for alcohol consumption, you could be equally liable for causing, aiding or abetting offences. Different industries have different acts that cover them. So you've got the Transport and Work Acts there that covers people like railways, tramways and guided transport systems. Again, having offences under drink or drugs. And you've got the Misuse of Drugs Act itself. Two sections of this apply to the workplace. Section 5 is the individual. So that applies to anybody either using it for their own personal use, intending to supply it, supplying it, having it in their possession. But Section 18 will cover yourselves as employers and occupiers or managers of premises. If you allow drug activity to take place on your premises and you turn a blind eye to it, and that gets obviously found out, then you can commit offences under the Misuse of Drugs Act of allowing your premises to be used for drug use, all of which come with either fines or even imprisonment on occasion as well. One that's not on there, in 2016, there was a new act launched, that was the Psychoactive Substances Act, that covers drugs that would have previously fell under this Misuse of Drugs Act legislation. Typical example of things like that is synthetic cannabis, commonly known out there as spice. Things like bath salts, which are similar to amphetamine and ecstasy. And I'm going to come back to the importance of those two parts of legislation very shortly. You've also got the Medicines Act. That covers things like your prescription medicines. Again, this is about people's knowledge and understanding. You have a prescription, it's written out in your name, it is solely for your use. If you go and supply it to another person, then you commit offences under this act for which you can be prosecuted. So what should a policy contain and how to implement it, and how can this affect your employees? So, well, it's a corporate formal document. It's no different than any other documentation in your company, like your holiday policy, your sickness policy. So yes, there's lots of things to consider. I've put on that right-hand side the who, the what, the where, the when, the how. That's what your policy really should contain. So let's have a look at some of them. It should outline where there is a need for a policy. Have you identified a risk? Is it specific to a job? Why are you actually doing it? And that should also include the health and well-being of your workforce. The purpose of the policy, and that is basically that you're encouraging this culture where somebody can come forward without fear of stigma, and that the policy is there to decide to protect the workers, but it's also there to protect the business as a whole as well. Who will the policy apply to? Is this going to be job specific? So it might be that you just do it to your forklift truck drivers. But what happens about your back office staff that suddenly turn up for under the influence of a substance? Is there going to be something in their contract of employment that would allow you, where there's reasonable suspicion, to test them if they're not covered in that policy? Or are you going to go right across the board with no exception from the CEO all the way down to the person that cleans the toilets, perhaps? Also, as well, remember, it's really important that sometimes you have contractors on your premises as well. Is this drug and alcohol policy going to apply to them? Or are you going to look to the external company that's supplying those people to do the drug and alcohol testing? How and when the policy will be implemented? Set clear targets, clear deadlines for this to come in, so everybody's got those expectations and they know when it's going to start. Within that period, what we say is at least have a period of 4 weeks. We call it a period of amnesty. That will allow people to come forward with any issues that they have, be it illegal substances issues, or that they're on a long-term prescribed medicine that could cause an issue if they're operating machinery at work. Outline the reasons for testing. What headings are you going to use? Are you going to do pre-employment? Are you going to do things like post-incidents where there's been perhaps either a near miss or a coming together of people? Are you going to do for cause where that reasonable suspicion is there? Are you going to implement random testing? Lots and lots of different reasons. In that policy, your testing methods, what are you going to use? Are you going to use urine for drugs? Are you going to use oral fluid for drugs? Are you going to do a breathalyzer for alcohol? Are you going to do them combined, or are you going to use them separately? What's that going to look like? What about the collection method? Who is actually doing the collection? Here at AlphaBiolabs, we have our own network of collectors within the UK who will come into your business premises and do that collection process for you. Maintaining what we call a strict chain of custody, which is actually legally defensible. And when I say legally defensible, these can be used in court settings such as employment tribunals as well. Or are you going to have somebody like AlphaBiolabs coming in and training your own staff, again, how to do a collection and that important chain of custody, so that you can do your own in-house collections? What type of drugs are you going to include in that policy? Now, I've mentioned the Misuse of Drugs Act, and I've also mentioned psychoactive substances and prescription medications. Are you going to have them all in, or are you just going to have things under the Misuse of Drugs Act? What does that look like? Are you just going to include 1 or 2 drugs, say like cannabis and cocaine, or are you just going to carte blanche say every drug that is covered by that act is going to be in that policy? Tolerance levels. Is it going to be 0 tolerance? Or is it going to be for alcohol? Is it going to be set at the drink drive limit, like the UK drink drive limit, which is 35? Or are you going to set it at the Scotland limit, which is 22? That's very important when you've got people that will cross border, especially things like HGV drivers going from one area to another. You need to really put both in your policy. What happens with negative results? Well, quite obviously, negative results, everybody can do their own thing and go back to work. But what does a non-negative look like? What happens if somebody has a show, say, for a urine pot? What does that look like? That should include things like secondary tests that need to be done. It should include things that, well, these are going to get sent to a laboratory like AlphaBiolabs, who work to an ISO 17025 standard. An award-winning business will do this testing for you and give those results. What I'm going to put all 3 together there: HR, outcomes, GDPR, and help and support. What are those outcomes? Are you going to say this is a straightforward dismissal, or are you going to say, actually, there's going to be a process of rehabilitation there, where we're going to support that colleague? On that note as well, it's really important as well to say that alcohol and other substances aren't actually covered by the equality and disability regulations. However, if that person has an underlying medical condition, which is a disability in itself, then they would be covered. So this is where it's really important that you explore why somebody has decided to take drugs or alcohol. GDPR, anything that's revealed is classed as sensitive personal data. So obviously that needs to be looked after very carefully, and only the right people need to have access to that. And probably one of the most important ones there is, what does that help and support look like? You know, are you going to refer them to occupational health? Are you going to get them to go to their GP? Do you have other support within your business that you could offer them? Or are you going to give them a lot of leaflets and a lot of contact details of where they can seek support? So really important that you pop in all that in. So we've got all of this, but what happens to your workers? Well, your employees are going to be concerned. There is going to be suspicion and lack of trust. CIPD research says that the more scrutiny that you place on a colleague, the more negative attitude they have to the workplace. For me, this is about communication. How are you going to say why you're having a policy in place? It will take some of that suspicion and lack of trust away. It could be quite simply that they're wary of testing. I go out into businesses all the time and I test people, and the first thing they usually say to me is, "Oh my God, you're not going to take blood. I don't like needles." You know, getting rid of some of those. If you've got it in your policy, there's nothing to fear. Some of the myths, there's lots of myths out there. Am I going to fail a drugs test because I'm taking Beecham's powder? You know, if I pop a penny under my tongue, am I going to be able to avoid a alcohol breath test? The big one in there, is it going to interfere with my private life? Well, what people do in their private life is what they do. If they want to drink to the heart's content, or they want to take drugs, as long as they don't get caught by the police, you know, doing offences, that's absolutely fine. But they need to understand the implications of still being under the influence of when they come into work, and what their obligations are to the workplace in terms of health and safety, and obviously legislation, especially if they've been driving into work as well. Does it mean I'm going to lose my job? Well, if you've got a robust HR process there that you can convey to everybody, they can feel confident in what that HR process will be, and it might not mean necessarily losing their job. And also, they don't always feel confident in going seeking help or support internally. So where else could they actually go? Is there anywhere you can actually send me to get this actual support? So a couple of guidelines about how to implement a policy. So you've decided to have a policy, you've engaged all your stakeholders, you may have done a working party, everybody's agreed to that term of reference, your union reps, your management, even other workers in the business. Get that sign off from your key stakeholders. That should really come with a forward from the CEO of the business saying this is what's happening, this is when it's going live, etc. Next part of the process really is communication. If the policy is not widely known, it's not going to land properly. And if it's not communicated, how are people going to understand it and comply with it? It's really important that the communication. Always remember when you're communicating out as well, to remember people that are not actually in the business. You may have people that are off long-term sick. You may have people on pregnancy leave that need to be caught up with later. A lot of people do the policy on onboarding as soon as they start the business. Some people send emails out. You know, it might be Teams meetings. As long as the communication there, that is key. Begin your testing wherever possible. Stick to the deadlines that you've set out. If you delay things, a little bit of suspicion may creep in, and they might think things are untoward. What's going on? This is supposed to have gone live today. Set those expectations out and stick to them. You can monitor the results. Have you seen a decrease in sickness? Have you seen a decrease in perhaps absences? Like I said, sickness. Have you seen a decrease in any accident rates within the premises? There's lots of things, or even a decrease in disciplinary matters. So there's lots of ways you can monitor. Review and monitor your training as well. Make sure the right people are trained. If you're, you know, you might have new managers on board, make sure they have the policy training along with training about their roles and responsibilities within that policy. And what we also suggest here at AlphaBiolabs is that you conduct a review every 12 months. Legislation changes, things change, but it might not just be that. It might be that you want to review the actual equipment, the testing that you're actually using. You might go from urine to oral fluid or vice versa. What suits you. Have a review based on your results and findings. It might be that you don't change everything, but it's always worth that actual review. I'm going to now hand over to Verity for the closing poll.
Thanks, Barbara. Yeah, thanks everybody. So yes, this is the closing poll for this morning. The question is, do you provide drug and alcohol training to your workforce currently? Again, simple answers of yes, no, or don't know. So I'll launch that now and I'll give you a couple of minutes to answer that one. Thank you. And I'll share these results with you, but it's quite interesting. Again, Barbara, we've got yes, 40% that provide training. Oh, numbers keep changing, but 59%, 59% that don't, and 3% that don't know. So quite a high percentage there at the moment that don't do training. So that's quite interesting. And Barbara's now going to cover the importance of training within the workforce. So I'll hand you back to Barbara. Thank you.
Thanks, Verity. Yes, the CIPD survey in 2020 stated that very few employees actually give any training to their managers, not only to recognise the signs and symptoms of drug and alcohol abuse in the workplace, but also how to effectively deal with it. It's education. This is really, really key. If you don't know how to deal with something, because you've not had that understanding, you can't really be effective. Likewise, if you're not looking for the right signs and symptoms, you're going to miss things, and that could potentially lead to implications like your accidents. 33% of employees, it came out as not training their actual workplace. So what can training include? It's really important that you do invest in training. We can, as AlphaBiolabs, when we come into businesses, we can really land your policy for you. These are some snapshots. One thing I will say from the get-go is this is tailor-made and bespoke to you. What do you want as a business? We will work to yourselves. We will work in line with your business policy. As a trainer for the company, I always read the policy itself. I get a really good understanding of that policy, so I know what I'm going into. If we're doing the awareness training, it's a really good open forum for our employees. It will provide that understanding of the company policies, how drugs impact in the workplace. They can be aware of the signs and symptoms, not just in any co-workers, but also in themselves as well. It will also outline the rights and responsibilities of employees. They have got a right to refuse, but what does that look like if they refuse? It will outline the company's responsibilities, again, enforcing why you're actually having a policy in place. One thing that people want to know is how will you deal with a breach of that policy? And also we can do things like counselling and support available. And there's lots of other add-ons to this, like looking at the equipment that we can provide. In terms of management awareness, we can cover all that, but there's also some additional things that we can cover as well. What are the most commonly used drugs, that are used out there? I come along with a very nice drugs box. They're all synthetic drugs, but it will give you that look and feel of what drugs look like, because it's not always what it is on the TV. We will give you the update on current legislation relating to drugs and alcohol, specifically as well concerning managers and the business itself. And what does that look like? We can take you through that sample collection process and chain of custody. What does that look like? What does it involve? We can do scenarios within that workplace as well for yourselves as well. What actions should be taken? What type of action should you consider? What are the recent employment tribunal outcomes been that may affect you on how you deal with something in the future? How to deal with any disclosure of information as well. We can also give you additional support in things like leaflets and handouts that you can pop into the workplace as well. But without the training, you are not going to be able to recognize any of this if you've not had that training. You're not going to know where to look for things. You're not going to know what the paraphernalia looks like, and you're certainly not going to know what the signs and symptoms look like. I always get really, really good feedback, and some recent feedback I've had where I've trained roughly about 500 employees was that they quoted that it really helped land that drug and alcohol policy. It set the expectations for everybody in the business, and it gave clear, defined roles and responsibilities for managers as well, and how to deal with things. So if I would say anything, that should really be at the top of your list. I'm going to hand you back to Verity now.
Thanks, Barbara.
Any questions?
Thank you for that great presentation. Yeah, we've got a couple of questions through, so I'll just do a couple because we're a bit short on time,
Okay.
but we do have one, quite an interesting one actually. So how should organisations adapt their policies and testing methodology when moving to hybrid working, which is obviously what a lot of companies are now moving to?
Yeah, it's a very, very interesting one, that obviously you know, you can't go out to premises, you can't go out to somebody's house and do a drug and alcohol test in their house. I would probably wouldn't advocate that, but there's nothing to stop you doing welfare checks. You know, you could assign a time for them to come into the office and perhaps then implement a drug and alcohol test when they actually turn up for that meeting. If that's encompassed in your policy, then it's yours to do. I think it's really important that as well that there is no legislation that governs a drug and alcohol policy. This is all about you identifying risks in the business and what steps you want to take as a business to address any issues. As long as you've got a justification for it, then you can put it in your policy. So if you want to say, like, I'm working from home, if you said, okay, tomorrow you're in for a meeting, as part of that meeting, you're in for a meeting, and as long as you've got it in your policy, perhaps to say that should you attend a meeting within the workplace, you could be subject to a drug and alcohol test, then you will be covered. You know, people then will have that expectation.
Could you also utilise walk-in centres, Barbara? So you could send your employee to a walk-in centre?
Absolutely, yeah. AlphaBiolabs, we have a number of walk-in centres within the UK. People do use it for workplace testing. They will send their employees to us to come into the workplace and do that test. So it's a pre-arranged appointment. Somebody will come in and do that test with AlphaBiolabs. You're quite right, Verity.
We've probably got time for one more. So there's another question that's come through. Who the policy applies to, would it not be seen as discriminatory if the management were not included or one particular work group were targeted?
Again, another very good question. A lot of policies are based on risk, and they don't include managers and they don't include people like back office staff. And yes, it could be seen as discriminatory, but it depends on, again, that communication. Why in your policy, why is it saying that you're only saying it's going to affect that proportion of your workforce? Why is it only your forklift truck drivers and your machinery operators versus somebody that does the franking machine all day? Personally, I would say it should apply to everybody. It gives a degree of integrity right across the board that nobody, you know, is left out. You know, people in high level positions, CEOs of companies that we saw on the press articles, managers, team leaders under increased pressure in the workplace, can be very susceptible to drug and alcohol abuse. So for me, I personally would say when you're doing a policy, encompass everybody. It shows that integrity. It shows that, you know, you mean business as a business, and it gets away from people accusing you of being discriminatory.
Thanks, Barbara. And we are out of time, but we will answer all of those questions and we will be emailing them out to you tomorrow. So you all will receive an answer if you have put a question through to us today. So thank you for attending today. I hope you enjoyed it and I hope you found it informative. If we just pop onto the next slide, just to share with you that following the webinar today, AlphaBiolabs do have a special promotion on if you do want to take advantage of it. It's 20% off policy writing. We can help you write your policy if you don't currently have one in place, or we could help review your policy if you want to review one that you've got in place, and also 20% off employee and management awareness training, the points that Barbara's just gone through. And if you quote the code that's on the screen there, AWPT20, then you'll receive your 20% off. Also, our workplace team are on hand if you've got any more questions regarding our services, the types of testing, types of testing methods that we can provide, then the team will be on the hand to answer them, and you can get hold of them by going onto the website or giving us a call, and they'll be around to answer any questions that you have. As I say, there'll be a little survey that pops up now. If you can just take a couple of minutes to complete that, that would be fantastic, because that will help us improve our webinars going forward and help us decide which topics to do in the future. So please just to take a couple of minutes to do that. But thank you very much again for attending this morning. A big thank you to Barbara for presenting, such a great job, and hopefully we'll see you all again soon and have a fantastic day. Thank you. Goodbye.
Thank you.